Dear friends, thank you for your invitation to the 15th edition of the European Patients' Rights Day, which has now become a regular annual event in European and national policy agendas to inform, discuss, and make commitments to strengthen patients' rights in Europe and in every member state. Since its birth in 2015, I've been a supporter of the MEP's interest group on patients' rights and cross-border health, because I'm convinced that there is a need to maintain a high level of attention on patients' rights and strengthening so the patients' rights across Europe, contributing to a stronger sense of belonging and European citizenship. Health is a prerequisite for the functioning of our society and our economy also. The COVID-19 pandemic is causing enormous human suffering and has a severe impact on health systems and health professionals. European citizens have increasingly expressed their expectation of a more active role for the EU in protecting their health, in particular as regards protection from health threats beyond national borders. We must listen to this reminder now, to this alarm, including in the context of discussions on the future of Europe. Attention should also be paid to the risk of widespread skepticism with regard to health measures, partly triggered by an increase of the misinformation on health issues. Health is a prerequisite for a dynamic economy that stimulates growth, innovation, and investments. So a strong European Union of health will protect our way of life, our economies, and our societies. But first of all, the rights of every person, the right to health of every person. The close link between saving lives and saving livelihoods has never been so obvious. With the publication on 24 of March of the regulation 2021-522 establishing a program of the Union action in the field of health for the period 2021-2027, the European Parliament wanted to give a strong and decisive response. The new health program, EU for Health, with more than 5 billion euros, is the fourth health program aiming to ensure a high level of human health protection in all EU policy and activities, in line with the One Health approach. The new health program certainly has the ambition to create a European health union with the objectives of improving and promoting health in the EU to reduce the burden of communicable and non-communicable diseases by supporting health promotion and disease prevention, protecting individuals from serious cross-border threats in health, strengthening the responsiveness of health systems, improving the availability and accessibility, including the affordability of medicines as medical devices, strengthening the health systems in their resilience and developing resource efficiency, addressing the implications of demographic challenges, and finally, but not last, as a point, the taking of the digital transformation. So we need to build on the experience that this severe health crisis has brought to us, and remembering that even before COVID-19, Europe's health systems were facing many challenges. Among the most well-known were the need to reduce waste and the use of health data in a better and more efficient way. Probably the aging of Europe's population is the main trend on which the spotlight was put before the pandemic and still represents the greatest structural challenge. When the population ages, the incidence of severe chronic diseases such as heart disease, stroke, and cancer increases. More than a year after Europe's first lockdown to fight the novel coronavirus, and with the imminent arrival of mass vaccination, it is certainly time to rethink the steps to be taken in terms of transforming Europe's health system. Looking at the last year, the pandemic has indeed accelerated some trends that were already starting, but were still in early stage before 2020. For example, the use of the telemedicine, which can be extremely useful for disorders that do not necessarily require the physical presence of for the examinations. So the impact of the pandemic on the health can now be described as for sure large and significant, but especially for the non-COVID health challenges. With the state of emergency halting many health prevention and promotion activities with possible long-term impacts on people's health and inequalities, this is certainly a topic that we need to deal with. So it will be important in the post-pandemic phase to understand whether and how communities have changed, because prevention and health promotion actions will need to take this change into account, not only to improve the response to the pandemic, but also to recoup negative impacts on mental and physical well-being of our people. As you rightly remember, citizens have the right to be updated. Your continued commitment to involving citizens and associations across Europe to better understand and implement health policies is crucial for us as policymakers and for citizenship as a whole. So thank you very much, and I hope we can continue working together like we did in these years, so that we can have a European Union that is closer to attaining a real and fully compliant system of rights for European patients, like they deserve. Thank you very much.